Hi, and welcome to this demo. I'm Fabienne. I'm the founder and lead developer here at Velluto. Velluto means velvet in Italian. The idea is making the patient onboarding and assessment process smooth for both the GP and the patient. Velluto is a clinical preparation platform used both by the patient and the physician. So it sits between the initial booking and the patient's appointment with you. It's engineered for compassion. Imagine Velluto is the clipboard. It collects scores and organizes information. You, as the clinician, interpret and decide. Velluto supports ADHD ASRS, adult and pediatric Vanderbilt and SNAP-4 assessments. It saves GPs about 30 to 40 minutes of admin per assessment and consultation. Let's now look at the GP interface. This is accessible by any web browser and it sits alongside Medical Director and Best Practice. We're now looking at upcoming appointments in the dashboard view with Fabienne Rabbiosi, the upcoming patient with an appointment on the 30th of March 2026, which is 2 days away. She is currently active and having an initial ADHD assessment. She's been invited on the 20th of March. In the overview, we can see that her triage is red. That means it requires your attention, particularly with regards to completion speed. Her average response time was 0.6 seconds per item, which was a little bit faster than expected. And her childhood onset needs particular attention because the difficulties were described as recent rather than lifelong. You can see all the steps that Fabienne has gone through to fill out her form right here. The observer report is in green. That means it requires your attention. It is pending. She hasn't completed documents because it's grayed out. Let's look at her responses now. So you will see all the information as if she'd filled out the forms right in front of you. The system checks for validation questions as well as other information. At the top of the page, you will see a summary of this assessment. There are citations that you can look at that take you back in the assessment. You can also download a PDF by clicking this button. You can upload this PDF to your medical software. Fabienne has received an email reminder to complete her pre-appointment intake. Within the app, she can check the status of her observer response, which is still currently outstanding. So she can copy again the link and send it to her observer, or simply contact them and advise them to fill it out. As soon as it's filled out, the GP receives an email. Let's now look at a pediatric patient who has not yet filled out the intake. So let's look at Lottie Smith. She is in for pediatric ADHD assessment, 4 days away. Lottie's parent has received the information to fill out. They can do that from their phone. It is very easy to fill out. This has been designed for both parents as well as patients who do not like to fill out forms once they're done. Again, you can see it in the back end. The Velluto clinical preparation platform has been built as a progressive web app. That means that it's actually a website that gives an app-like experience without needing to download an app. Patients do not require a login, do not require an account. Whilst the experience looks like they may require an app, it's actually not an app, and it's just a button in the email that takes them straight to the website. The whole workflow is fully automated. You do not have to chase anything manually and focus on practicing good medicine. No data is used for AI training, and all data is hosted in Australia and it's compliant with medical software requirements. Have a look at velluto.health, our website, where you can find more information and sign up for a free 14-day trial.